Hello and welcome to India Speak, the Center for Policy Research's podcast series. I'm Yamini Aiyar, and joining me today is Shailendra Sharma, Education Advisor to the Government of Delhi. But we're not going to talk with Shailendra today about his role in education and the education reform story of Delhi, which is actually a podcast, Shailendra, we must record at some point sooner than later. But today we are going to talk to Shailendra about the pandemic and his experience as a insider, outsider within the Delhi government's administration, responding to the crisis as it unfolded in those very, very dark and difficult days of April 2021 when the second wave hit. Shailendra spent a significant amount of his time in early April away from his regular duties as education advisor, working and supporting the oxygen control room that was set up in response to the crisis in the middle of April. I want to discuss with Shailendra what it was like to be in the thick of that control room. Not only were we confronting a crisis of deep, deep distress, one that was deeply personal for most of us residents of Delhi, because there probably wasn't a single family or single individual whose friends and family were not badly affected by this crisis. But there were also larger concerns of managing the health system in the midst of constant SOSs about lack of basic supplies and, most importantly, oxygen. So what was it like to be a frontline worker in the middle of this crisis? How did the government react? What did it mean? What were the kinds of stresses that Shailendra himself confronted? What were the big challenges they saw? And what did they do to slowly resolve the crisis and ensure that hospitals and patients had access to what they needed in order to be able to recover from the ravages of COVID-19? Shailendra, thank you so much for joining us, and a very, very warm welcome to you on the CPR podcast.
Thank you, Yamini, for inviting me. Thank you.
Shailendra, so I really want our listeners to get a bird's eye perspective of what it was like. If you could just talk to us about how you came to the oxygen control room and what was happening in those first early dark days when the SOSs started.
So, Yamini, as you rightly described, my role with the government was that of an education advisor. But from the second week of April, in fact, towards the later part of the first week, the entire focus of the government was getting concentrated to respond to the emerging COVID situation as a result of the second wave. So when things started building up, it was because I was closely involved with the government. I could see what it is leading up to, and anyone who was available at that point was needed to support that effort, because as you know, I mean, the impact this time was such huge that even the people who were from the health department or who were like working in this segment were themselves getting affected. Many of the officers you'll talk the previous day, and you will hear the next day that somebody has turned positive, somebody is moving to the hospital, somebody is recovering at home. So as a result, what remained was to basically to respond to that situation. And I told myself, if I am so to say fortunate enough not to be counting my own oxygen saturation level, then it makes it is time for me to step in to support the effort of the oxygen control room that was set up. So that is how I moved to that control room to assist the work which was already going on there.
Shailendra, can I just ask you to just tell us a little bit about that oxygen control room? What was it? When was it set up? And who was sort of leading the activities inside that control room?
So I would say oxygen control room actually evolved. Some form of that control room came into existence around the first week of April. But it started building up somewhere after 14th April. So there are three dates which are very important in this entire discourse: 14th April, 15th April, and 16th April. So this is the time when the oxygen as a real crisis started emerging. And 16th April was the date when the government of India stepped in to regulate the oxygen distribution to various states. So I would say that was a time when oxygen control room started taking shape, because as a result of it, what was required was to ensure that the oxygen which is allocated to the state as per the quota is actually lifted, brought to Delhi, and distributed. So I would say that from 16th, around 15th, 16th, this control room started taking shape. And as we proceeded, as the gravity of the situation deepened, we had more and more people joining in, and more distribution of work in the control room also started happening. So I would say from the middle of April till until say middle of May, that was 1 month when the oxygen control room was at its peak.
And how was it organized and structured? Who was leading the activities and what was the coordination? It was the government of India stepped in on the 16th of April to regulate the quotas, but there was lifting of the oxygen and ensuring its distribution across the hospitals. So just give us just to contextualize the daily goings on inside that control room. Just give us a little bit of an understanding of the structure.
So I'll divide my response into three parts, Yamini. First, as you would recollect that when during first wave, like last year, we had rarely heard about oxygen as a major issue. The thing is that the hospitals, both government as well as private, operate with supplies, including medicine and other accessories, which is they do through the manufacturers, through their own vendors. Oxygen too was in the similar category. So all the hospitals that you have here in Delhi, and I guess that would be the case all over the country as well, have their own supplier of oxygen lined up, and it is provided to them as liquid medical oxygen in a container, which are big hospitals, or it is supplied to them through cylinders. So this was a mechanism which is like a private arrangement between the hospital and the concerned manufacturer. So that is how it has been going on till 14th April. And I would say that 14th April was a day in Delhi when the big surge happened. That was a day when the total positive cases, active positive cases, crossed 50,000 for the first time, 50,000, 50. And the total number of single day case on that day was 17,000 plus. Over a period of time, that reached up to say 28,000 also on a single day. But that marked the watershed day. And to give you the context, when this happened on 14th April, the next day, that is 15th April, hospitals needed more oxygen and they could quickly assess their suppliers and they got more oxygen. So just to get the context, the daily requirement was somewhere in the range of 170 metric ton to 220 metric ton. But on 15th, they needed 300 plus and they got that. But when the demand increased from all over the country, this distribution and the lifting of oxygen needed to be regulated, and therefore the government of India stepped in. Now, what happened in the case of Delhi was that this oxygen control room, it was more in the form of say, supply ensuring. So when the allocation was made, it was more like the plant which has been allocated, how the oxygen is going to be lifted from there. So this part was led by a young IAS officer, Udit Prakash, who was also Principal Secretary Health. So in his role as Principal Secretary Health, and because he was also Director of Education, so I've been working with him closely. So that is how I could see that our entire discussion during that time would be that of oxygen. So he was responsible for making sure that the supply which is allocated actually reaches Delhi. And then once you have that set up in place, the other part was distribution of oxygen within the within Delhi among the hospitals and the retailers. And then that part was allocated to another IAS officer, Vijay Vidhuri, who had the charge of managing director Delhi Transport Corporation. And I think it was a very strategic choice of having Vijay Vidhuri as in charge of distribution, because he has with him at his disposal fleet of DTC buses and DTC bus driver and the entire staff there. And in the distribution, as you would know, a lot of route planning, movement of the vehicle is required. So he was just the right person to handle that. And then Vijay Viduri and Udit Prakash both created their own team, and this team came into being, which we now know as Oxygen Control Room, and it started functioning 24/7. So there was a supply part to it, and there was a distribution part, and both of them kind of say with a lot of coordination among them ensured that is taken care of.
So in that phase, so it seems from your description that by about the 16th of April, a structure had been put in place for managing the lifting of the oxygen from the site, and then ensuring effective distribution. But if I am not wrong, by about the 20th or 21st of April, there seemed to be a significant supply crunch, and the hospitals started raising SOS. Can you describe to us what was happening inside the control room when those midnight SOSs started?
So what happened as a result of this allocation was, as I described earlier, there was a pre-existing arrangement between hospitals and their suppliers for oxygen. But when reallocation happened, new plants and locations were allocated. Most of these plants did not have a pre-existing supply route. So to give you an example, the supply to Delhi used to come from plants located in, say, Faridabad, Panipat, some neighboring districts of Uttarakhand, UP. So you were getting oxygen from the plant, which was like, say, 100 to 200 kilometers from Delhi border. But when reallocation happened, the quota was allocated to different plants. So as the build-up happened, and also there was a situation where the oxygen demand was also surging. So when the first allocation happened on 16th April, Delhi was allocated 300 metric ton of oxygen.
Shailendra, can I just one question there, because this allocation of oxygen became quite an issue, and ultimately the courts had to step in. What was the basis on which this 300 metric ton allocation was made? Was there any consultation, deliberation with the government, or was it a decision made by Government of India?
So there was like some kind of this basis also changed as the time progressed. It was like prior usage and some projected demand. So that is how it was allocated, and then over a period of time, it started getting balanced. How much other states would be requiring, how much which one would be requiring. So I wouldn't say that there was any consistent basis of allocation. Now you must understand that there were two different kind of formula that was adopted. One was allocation, which was based upon projected demand and all. And once you were getting the oxygen, the reallocation was allocation to hospitals was being made on the basis of usage and the projected usage. So it was quite a complicated situation at that. But the allocation was not in sync with emerging demand because the numbers kept swelling. So any calculation that you do based upon the previous day's things and also availability at different plant, that may not work the next day. So that is why there were series of orders which were issued from 16th April onwards, raising the allocation as things progressed. But I would say it was never like whatever. Delhi at one point of time projected that based upon the realistic estimate, now our requirement is that of 700 metric ton, which was and it gave its entire calculation to the High Court when this matter was agitated, and the High Court was convinced that Delhi's actual need is that of 700 metric ton, and it directed the central government to make sure that those were made available at Delhi border. But only on one particular day during this entire what you say situation, that Delhi actually received more than 700 metric ton. In fact, that the last order which was issued by the government, it allocated 590 metric ton, and even that, getting that oxygen was also a nightmare, because what was there was key those oxygen were allocated to plants, say located in Jharkhand, in Odisha, in West Bengal. There was no supply chain from these locations to Delhi for oxygen. So as a result, you have to think on your feet to ensure it was not just about allocation of oxygen, it was also actually lifting oxygen from those places and bringing it.
So, and the sites of where supply was to come from, those again were determined by Government of India or the courts.
No, that was determined entirely by the government of India. The government of India allocated, and those plants, which were manufacturing plants, were directed to. I mean, this supply allocation order was issued and provided. Now, when the courts stepped in, the responsibility was started getting fixed. Who is going to make sure? And court accepted Delhi's argument that because we do not have our own manufacturing things, and the plants have been allocated, which is like way beyond Delhi's things. So it should be the responsibility of the central government to make sure that those oxygen actually reach the border of Delhi. Once it comes to Delhi, it should be the responsibility of the Delhi government to judiciously distribute it. But bringing it up to the border of Delhi should be the responsibility of central government. So Indian Railway also stepped in to make sure that that supply is coordinated.
So, and in all of this, as these logistics were being worked out, hospitals and citizens had begun to raise alarm bells. So, how did you then manage that process?
So before I answer that, let me step a little back. Once even the allocation was made and the supply route was determined, Indian Railway was ready to run as many trains as required. But the bigger issue, Yamini, at that point was the availability of adequate number of container and tankers. This is not like you're not bringing, say, some. It is oxygen is highly inflammable element, so it has to be in a particular kind of container and tanker, and there weren't enough container and tankers within India to meet everyone's requirement. And in other states, which were manufacturing states, we also got the news that those which were available also were getting appropriated by the state governments for their own real or imagined usage. So the problem was that of container or tanker. And I remember in one of the meeting at one point of time, one of the leading manufacturer of oxygen telling the government, you see, we can step up our oxygen manufacturing like anything. You tell us how much is required, we will be able to augment our production capacity. But there aren't enough container to take it. And these trains which are going to bring oxygen from say Jharkhand, Odisha, and West Bengal, they would take 30 to 36 hours to reach Delhi. And then you have the whole decanting process, which takes its own time before it finally reaches the hospital. So that was the complication at that point of time. Now, coming back to the question that you raised. So as a result, when the numbers started rising, this was unprecedented time, Yamini. If you remember last year, the message from the government was, or even the medical fraternity, that not anybody who is called COVID positive doesn't require to be in hospital unless you are showing some other signs of it. So as a result, the hospitalization rate was not as high. But this time, because of the variant that was there, at one point of time, more than 20% of the active cases were actually in hospitals. And those which were reaching hospital, the first thing that they would be requiring was is the oxygen supply. Because when your saturation level dropped below 90, that was the time when you actually needed to be hospitalized. And there were cases where oxygen saturation level was even dropping below 80. So oxygen became a very important commodity at that point of time in hospital. And as I described earlier, the supply was erratic. Uh, so whatever a supply was available to, whatever material was available to hospitals, they had to then use it among the patients that they had already got. Of all the patients which were admitted in the hospital for COVID, nearly 25% at one point of time were in ICU. ICU requires much more oxygen than the other ward. So the oxygen requirement was surging, supply was indifferent. So therefore, this crisis started emerging, and we would get SOS calls like anything. So Delhi control room set up a dedicated helpline number with 10 floating lines, which was active round the clock. And its role was basically to note down the SOS, understand the gravity of the situation, and respond. Because we had by that time started keeping some oxygen in reserve to respond to those hospitals' need, where we calculated that based upon what they received last time and how much they would have used by that time, they are really headed for crisis. So that is how this control room started responding to the SOS.
Shailendra, describe for us the mood and the tension when these SOS calls started coming from the hospitals. I think it's important for all of us to understand the context and the nature of the crisis that all of you had to experience and live through, as you were also desperately trying to search for sensible solutions to what seemed to be an almost irresolvable crisis.
So I would say it was nothing sort like a war control room at that point. There were two set of functions which were happening. One was securing supply from the plants which were allocated, uh, getting the nearby plants, which were like say Uttarakhand, Haryana, and UP, where we started sending our own tankers, which were taken from the suppliers from Delhi, whichever were registered in Delhi, getting those supplies lifted from those plants, which was an Herculean effort. I'll describe a little later about that. But the oxygen distribution part, where these containers were reaching, were being sent to hospitals. Now, there were a team of about 30 people roughly under Vijay Vidudi, who was responsible for distribution. This team was receiving SOS. So they were floating call. And at any point of the time within 24 hours when you go there, this was like a buzzing place. Calls were constantly coming. You could see on the monitor the calls were flashed. The requirement from those hospitals were mentioned there, and somebody making calculations, somebody trying to see which is the nearest place from where this supply can be rushed. Multiple calls coming from, there was this SOS line, then there were people tagging on Twitter, which was being monitored. Then there was like a newsrooms flashing the breaking news that this supply is running out in this particular hospital in next hour or so. And it was so much a judgment call. And if you look at the faces of people who were there, I mean, there were people who had not slept for days right there. And in those rooms, making quick calculation, calling up our own drivers, giving instructions that this place needs to be reached, lining up police where there was also situation of say rioting or looting if the vehicle goes there. So it was like a complete. Everybody was on their toes at that point, and there was also a palpable tension because it was like a touch and go situation also in many cases. And what also started happening at that point was that many hospitals, even if they have supply left for say next 10 hours, they would raise an alarm that it is getting over in next 2 hours. I wouldn't blame them because they were apprehensive that maybe in 10 hours they would get or not because of the uncertainty over there. So raising that alarm and raising that alarm through different channels. So, but what this team started doing was collating all the information that was coming, so that you know that the same request is coming for the same hospital from different sources. So you need not react to all of them. You have to make a realistic assumption about how much oxygen is left there and at what point of time they need their supply to be augmented. So this was the work which was doing the distribution, which was being done by the distribution team.
Wow. And I remember when we spoke in the middle of this, you also talked to me about some of the hospital visits that you were making at the time as well. Could you also give us a sense of what it felt like to walk into those hospitals? Of course, everyone must have come rushing to you and the team because you were the only lifeline that hospitals and patients had. What were the kinds of issues that were being brought up when you would go there?
So in that period, uh, Manish Sisodia ji, who's Deputy Chief Minister of Delhi, was also made in charge of COVID response, and he, along with the Health Minister Satyendra Jain, started making rounds of the hospitals because we realized uh, that a no, it's not just about say distribution, but also standing with our hospitals, standing with the doctors and medical staff, which was handling the situation on the ground. It was important that senior people from the government go there, not just to assure them, to give them confidence, but also to make a realistic estimate as to how, and also talk to those to the doctor as to how with limited supply the situation can be better managed. So they started making rounds of the hospital. So every day, both of them, the health minister and the deputy chief minister, would visit hospitals. They even put up their PPE kits and walked in the COVID wards of the hospitals. Because as you know, these wards are severely, I mean, not many people would feel confident getting into that. But then they started moving into those hospitals, talking to the nursing staff as to what is the shortage and how they would want to be supported in that. So I think this visits to the hospitals, talking directly to the medical staffs, getting engaged directly with the control room across the time gave a very good understanding of the ground situation, and the people who were risking their life and giving everything to save the situation also felt confident that their leadership is with them. So I think it worked both ways. And this assurance by the top functionaries of the government went a long way in boosting the morale. I was in control room at that point, and I could see how people were people feeling confident about it.
And in between all of this, you spoke a little bit about the role of the courts in fixing responsibility, in particularly around the question of allocation of quotas, in bringing in some transparency into the process. And a committee was also set up, if I recall right, sometime in late April, early May. And then you also mentioned a little bit about the states, the supply being located in states that were at a distance, and states too jostling to be able to ensure that they could protect what they felt they needed in their states. What is your sense of, how do so I guess they're two separate questions, but let me pose them to you, and you can answer them together or one after another. It seemed to me, as well as a observer from the outside and a victim of COVID and the situation that was unfolding at the time, that one what was really missing in this whole oxygen story in particular was good state to state coordination. in the sense that Delhi's requirement was X, and it is, Delhi's requirement was X for reasons that doctors and scientists will tell us. Other states at that point were not experiencing the same kind of surge as Delhi was, and it could have been possible potentially for that period of time for these neighboring states to release some of their quota for Delhi, so Delhi had access, and on the promise and commitment that as and when they need it, Delhi would also support them. And I felt consistently that state to interstate coordination was missing, perhaps because there is no institutional platform for this, but that was a big missing link in the entire nature of the response, and what I think also sort ended up accelerating the crisis in and of itself. And the other thing that I would like for us to reflect on a little bit is about the role of the courts. I mean, we've in the old days, pre-crisis days, there's been a very vibrant discussion in India about the extent to which the Indian courts are interventionist, placing themselves in the midst of what are essentially administrative and occasionally political decisions, sometimes leading to very bad consequences. But it did also seem that at a time when we needed more transparency, we needed more action, when citizens were feeling like they had been sort of left to fend for themselves, that the courts actually stepping in helped to address a lot of these difficult pain points and huge bottlenecks, particularly around transparency of allocation of resources, etc. So what does this tell us about the role of the courts in a moment of crisis? And how does administration, I'm not politics, how does administration respond to the courts? So these are two sort of reflective questions I'd like you to reflect on. As I said, they're two slightly different questions. Pick and choose which ones you want to pick, answer, and how.
So, yeah, it's quite a long question and interwoven into, say, different aspects. But I would say that when the crisis unfold, probably the chaos follows. And this was not a situation which anybody had anticipated, that you will suddenly require such a huge amount of oxygen. Of course, the signs were there, it was building, but it was not as if like anybody can say 6 months before this situation, people would have projected how much oxygen you would be requiring. I could say of any other matters, but not of, say, oxygen. In fact, even the projected beds that were created to augment the existing capacities of the hospitals to take in the patients. Now, the assumption which was made, the amount of oxygen that you would be requiring was based upon what standard you saw in the previous wave or historically. So as a result, this is the calculation that continued for many time. Now it is being questioned, debated, and let's see what comes out of that. That of all the number of beds in the hospitals for COVID patients, only 50% of the bed was projected to be requiring oxygen, and that to say 10 liters per minute calculation. But we saw in the cases that anybody who was getting admitted in the hospital required that oxygen. So the initial projection that you were making of, say, 50%, but actually became that of 100%. So it was very difficult to then manage with whatever has been given to you. Now, coming to the second part, when the new plant was allocated, or even the existing plant from where Delhi's own supply was coming, that plant also got allocation to distribute oxygen to other states or the home states also. So we had like a initial few days a kind of jungle raj at those plants, because what some of the states did was to ask their DMs and SPs to sit at the plant and make sure that the vehicle which is meant for, say, Delhi does not go. Instead, it should first distribute within their own state. So we had situation where our vehicles were stopped on those plants. When they would queue up, Delhi's turn would be like, no, you can't fill. Your turn will come after, say, 10 hours. So those were the situation. It was like quite a chaotic situation to begin with. And but the point was that we were so grounded. What we did was we started sending our own nodal officers to those plants. Those nodal officers, in the face of the state machinery, could not have done much to change, but at least we were getting real time information from them as to what was happening. And we started raising the alarm at different levels. So there was this intergovernmental coordination group which was set up at the behest of the Delhi High Court, where the officers from the Home Ministry were made personally responsible to ensure those coordinations. So this issue started getting raised over there. So over a period of time, this situation started like settling down. But the initial few days was like a fist fight to get our supply there. The container, the tanker which will move would be diverted in that city to some other places. So we had the situation where we get go ahead. Okay, the container from Panipat has left at 10 o'clock at night, but you have no idea when it is going to reach because that has been diverted by the government of Haryana to some other place. So that thing started happening, and it took some time to settle. But I would say that the Delhi High Court played a great role in, say, kind of arbitration, I would say, in ensuring that the responsibilities are actually fixed. And was what helped the matter was that Delhi, because of its ground presence, because of its officers very regularly involved, did a very meticulous calculation as to how we can get our supplies and what is our requirement. So the court's role, I would say, was very useful, because in this kind of, say, federal setup, where the states had jurisdiction over the area in which the plant is located, every state has invoked Disaster Management Act, which has a very stringent provision, so they can appropriate anything which they deem necessary. So in that space, Delhi's position became very weak, because Delhi was not a manufacturing state. Delhi did not have its own manufacturing plant. Whatever supply was to come to Delhi was that of from the other states. So I remember in one of the proceedings, the position was taken by somebody that the allocation has been made to Delhi. It is their responsibility to lift it up. And the court struck down that argument, saying that Delhi cannot do that because Delhi doesn't have jurisdiction over other states. So it is the responsibility of the central government then in that case to make sure that the allocation reaches Delhi border. Now from there onwards, Delhi's responsibility starts. But having said that, that was more like a umbrella and the framework part. But the actual, what you say, implementation of those directions still required a lot of government to government, lot of officers to officer, I would say, coordination to make sure that things move smoothly. So armed with this kind of a thing, we were able to rope in Delhi police, and we could send our police personnel from Delhi to those plants, neighboring plants, which would then escort our tankers up to the Delhi border. And within Delhi also we could get the PCR, which would escort, because what was also happening was that when the tanker would reach one particular hospital, there would be another hospital nearby whose allocation would be coming from the different vehicle scheduled at different point of time, would be willing to appropriate this vehicle. So in order to make sure that these vehicles move, we had to rope in police, and administrative staffs were positioned at different plants also. So much so that even during the later part, in locations like Jharsuguda or Kaling Nagar, which is in Odisha, we sent our officers at the plant to basically make sure that there is no delay over there and the loading and unloading happens. So a lot of coordination was required among the officers of the central government, Delhi government, and the state government. And we could see that that coordination started taking shape more so as the things progressed and things started like settling down. But the initial few days was nothing short of chaos.
That's Shailendra. Thank you so much for giving such a deep insider perspective on what was going on, and really, taking us into that control room and giving us an understanding of how complex even simple logic, what seems from the outside to be a simple logistical exercise, really is.
And Yamini, to add to that complexity, the thing was that everybody in that situation was also learning. Because what was happening, no officer would get into the detail ever how the oxygen is decanted in a particular hospital. That was a highly technical kind of a thing. So what also started happening was when the container and tankers started coming from different part of the country. I remember one train with 7 containers came from Mundra port, and those containers were those which were imported from Middle East. Each of these 7 containers had different nozzle fitting. So once they reached Delhi, taking the oxygen from those container to our container was a Herculean job. And now anybody sitting outside would say, what the heck? I mean, you have it here because you needed the right kind of nozzle to fit in. Now, if you do not have that, the nozzle will have to be made there. You cannot make that projection which kind of container is coming to you. So small theory things, and frankly speaking, for the first time in my life, I understood the meaning of what they say, that the devil lies in the details. So those details would kind of say derail. So you have like those container it is taking 10 hours to decant because the nozzle is not fitting. The right kind of technician which is required to make that nozzle may not be available over there. And then everything is held up because you are not decanting it, they are not being sent back quickly. So those were the issues that were also coming.
Who would have thought? You're absolutely right that so much of this is about the detail, and the details always are the key issues that cause the bottlenecks. I remember watching on television the oxygen tankers being driven with police escort on all sides, thinking to myself, what has the world come to? But there was a very rational, logical reason why that had to happen in that particular moment. Shailendra, you spoke a little bit about the lessons, the details, of course. What I'm also learning from you, the intergovernment became such an important thing. Nobody, I think, least of all, frontline warriors like you would want a repeat of this to ever happen again. What are lessons that we must learn? What have we learned? You're still sitting in the thick of administration, so you probably have a much better view on what steps are being taken. But also beyond that, if I can ask you to give us a little bit of your insight into you were now witness to the health system at its most critical moment. If there were, from a long term perspective, what are things that we need to do to strengthen the health system? What would be those 1 or 2 learnings that you picked up from this experience?
So I would say that there is like a lot of scope for improvement in the health system. Even in a non-COVID kind of a situation, non-crisis kind of a situation, there's still scope for a lot to improve. Having hospitals with like we were discovering that the own data management system in many of those hospitals were not great to begin with. So in fact, in the initial days, it took a lot to kind of say calculate as to how much is the actual requirement of this particular hospital. So I think strengthening the capacity of the hospital to manage its own affair, and I'm not saying that only of the government hospital, but that of private hospitals also. That is one area where a lot of thinking and planning has to happen in terms of, say, hospital management. The second area where I see is a lot of scope is expanding the network of hospitals. So you have certain areas the distribution is quite skewed. Now, if I were to talk about Delhi government own things, this idea of mohalla clinics, which is like a primary health center, this is planned to with a very spread kind of an approach, so that almost every mohalla or the neighborhood has that kind of a clinic. I think a similar kind of exercise would be required to map, say, create the tertiary health facilities, the specialization facilities, distributed across the city. And for both private as well as the government hospital, the management benchmark has to be established. And I would bring in my education experience, education perspective into this. Like in the education, you have the government school as well as the private schools, but it is the responsibility of the government to regulate the private schools, the kind of fee that they would charge, the kind of curriculum that they would follow, the qualification of the teachers. All of these are regulated by the government. I think a similar robust, I would not say, I am not saying that there doesn't that it does not exist at the moment, but I think those needs to be revisited to make it more contemporary. So I think a lot of work is required, and also learning where there can be glitches. Like for example, oxygen supply itself, if you were to take in, there can be small, say, there can be containers which can be set up in big hospitals. There can be small manufacturing unit can also be created. Industrial oxygen cannot be manufactured in Delhi because of the NGT regulation, but hospitals can set up their own small plants. There are land requirement and safety protocols that are there in place, but at least where there is a scope for doing that, that can be done. Reserve facility needs to be created, which is now being done. So we have now like a reserve facility which has been created in 3 government hospitals. We now have more cylinders which have been imported this times, because that can always be kept in reserve. So we have already procured 8,000 cylinders which are there at the disposal. So that can always help in augmenting the bed capacity whenever you require. I mean, you had COVID situation now. There can be any other situation in future. So keeping that in mind, what would be the supply chains that are essential supplies that would be required? So making those kind of projection, and be able to kind of say set up and augment the capacity within 24 and 48 hours. So that kind of planning, I think, is required in order to kind of say prevent situation like this from happening again.
Shailendra, before we close, I have to ask you to reflect a little bit from you have this unique window of being an insider outsider, and I don't know if you ever imagined a situation where when you came in to advise the Delhi government on its education policies, that you would find yourself in the midst of truly a horrific crisis of this nature. But what has that taught you about India's administrative capacity? And what surprised you most about the response in both positive and negative ways? Just if you were to step out of your government role back into your civil society role, we all have our perceptions, our own cognitive maps through which we view bureaucracy, especially at the front lines. And in popular culture in India, some of it is not untrue. The bureaucracy has a certain image that is not necessarily very flattering. But when one gets in deep into the weeds of what happens inside administration, we also realize how much government actually works. Sometimes not always productively, but it's always at it. And it is ultimately the internal logic of administration that moves one, that helps societies through moments of crisis such as this. So what did you learn about bureaucracy from this crisis? And what of your pre-existing beliefs were reinforced, and which of those beliefs were challenged?
So personally speaking, I think the last time oxygen gave me sleepless night was when I was taking my chemistry examination for board exam. So
One can only wish it had stayed that
right.
way.
So I thought oxygen doesn't matter thereafter, but till it came in this manner to haunt us again. But coming to what my understanding, Yamini, on this has been, that probably bureaucracy functions best in crisis situation. When there is a normal situation, it can be good, bad, or ugly, depending upon who is at the helm. But in terms of, so you have a crisis situation, you have a normal situation, and you have a vision kind of a situation where you can visualize and think being futuristic. So in crisis situation, it works very well. That has been my experience. In the normal situation, it would be more like okay. Uh, Again, depending on the commitment of the officer concerned. But in terms of being futuristic, I have my own reservation. That's not probably the way bureaucracy is conditioned, and that is where the role of the political leadership, I think, steps in. The more futuristic the political leadership is, the better output it can get from the same bureaucracy in terms of preparing for the future. So that's a big takeaway. I would say it is. So the political leadership becomes extremely critical in thinking ahead. Bureaucracy can manage your today's situation. Bureaucracy can respond amazingly in the crisis situation, and that I saw. Because as different elements of the administration steps in, the power structure, the rule books, the distribution of responsibility, it starts shaping up, and everybody then takes up because it is your responsibility to make sure that the situation does not go out of control. And in that, again, I am not discounting the individual valor of the officer concerned. And we had two fabulous officers in Udit Prakash and Vijay Viduli, who were outstanding in those situations. But what I would also say that they were aided by the same structure which they were representing to be able to perform the role that they did. They could have got away with slightly less effort also, but that was their personal commitment. But the structure itself gave them immense power to use that power for good, which they did in those circumstances. So as a result, what would happen is when the crisis is brewing in Haryana, Udit Prakash can call his counterpart and and make sure, and those hierarchy in the government would come to aid. You see, I'm an IAS officer of 2007 batch. What's going on there? So if that person happens to be a junior, he would respond irrespective of the fact that you are from the different cadre. So that kind of a structure came to help if you wanted to seek help. The military, the army came to help, and they offered their resources to be used in Delhi. As a result, we could decant many of those things there. But it needed somebody to coordinate that effort, and that nudge in this situation came from the courts. So I think this formal, what you say, the separation of power structure, which is there as a cornerstone in the constitution. I think it's a very what you say important segment which needs to be understood and used. Now, in terms of say normal situation, what I would say is it's more like say the kind of drive which is coming from the top leadership, the kind of initiative that the concerned officer would like to take. So many factors play. So as a result, it becomes very important that you have your political leadership committed to the cause. And once the bureaucracy realizes that the political leadership is committed, the courts are serious, then you see a different face of the same bureaucracy. So I would say that this is the factor. And of course, lastly, Yamini, I would not also discount our own like cultural factor. I mean, the way we are. I mean, generally, how serious we take the warning or chalta hai attitude also. So at the same time, when you have people here, ye koi bahar se, these are not outsiders. They are people from the same society. So whatever values, whatever biases we have, those are reflected in the working of the bureaucracy also. So it's not very different. So as a result, I think it's a mixed thing. But to sum up my own thing, I would say my faith in the system enhanced. I have no reasons to believe that that they let down. The situation was that of a crisis, but most of the people that I know of in this situation stepped up. And another interesting thing happens, Yamini, in the crisis. It's like a filter process. So only those people would be visible or doing the things, even if they are not visible, so to say, who have like a conviction and belief to have to play that role. Others would on its own be sidelined, or they themselves will take a step back also. So you will have kind of say a very natural and organic situation emerging where people would take responsibility. Those who feel it is their responsibility, those who believe in the cause, they would be there, and others would be like become fence sitter, they would not be there.
Shailendra, thank you so much. You've ended our conversation on a fairly optimistic note and a very important reflection. The logic and structure of our administration, its own hierarchies and its red tape, that often we complain about and often are over ritualized in ways that prevent the bureaucracy from responding in the normal everyday, actually do play a role, particularly in a moment of crisis. The bureaucracy is able to respond effectively in moments of crisis in ways that fulfill the core ethos of what it means to be an administrator, what it means to be a public servant. And even as there was mayhem in Delhi in those very dark and difficult days, the backbone of the bureaucracy helped to at least create a context where some aid and support was provided. Shailendra, your insights have been really very valuable. I think the real big question that you ended our conversation on, about what it would take to move the successful elements of bureaucracy that work in a crisis into enabling the bureaucracy to work better in the normal everyday, and more importantly, to be able to respond effectively to the futuristic visions that occasional political leadership does present, or even build its own internal ethos of a sense of organizational purpose and goal of public service, is something that we need to reflect a lot more about in our discussions on administrative reform. And I hope to bring you back onto our podcast to discuss some of this in greater detail, particularly in the context of all the work on education. Thank you so much for joining us, and looking forward to another round of this conversation very soon.
Thank you so much, Yamini.
Thank you for listening. For more on CPR's work on COVID-19, you can follow us on our Twitter handle at CPR_India and visit our website at www.cprindia.org.